Let's proceed into the second topic. My second topic to be present is about the information sources, the COVID-19 and the vaccine, and their influence in Taiwan. Uh, for information on COVID-19 or any kind of medical illness or infections, disease, timeliness and accuracy are fundamental to reduce and curing the disease for both the public and the scientific communities. Information have a proliferating on traditional and social media since the COVID-19 outbreak. However, repeated media exposure to crisis-related information elevated anxiety and stress response among people. During the pandemic, people may receive information from multiple sources. The most common is the internet. Traditional media is also common. In addition, medical staff and lay people such as their friends, family members, and colleagues are also the information sources. Understanding the factor relative to such information sources is helpful because it can aid health professionals in educating individuals in particular and the public at large. It also aids health professionals to develop information delivery systems that are transparent and effective. Among the public, the Internet is always the most common and popular source of information on the etiology and intervention model of medical illness, not only during the COVID-19 pandemic but also before the pandemic. A study of 31 countries, this study conducted in Taiwan, found that the number of Google searches for washing hands increased with the low speed of COVID-19 spread. However, misinformation on COVID-19 has also been proliferating on the internet, especially, especially on social media. So, we are very interested in how have people in Taiwan received information on COVID-19 and what was the association of various information sources with the knowledge, cognition, and the behavior of people in the pandemic. Uh, in 2020, we conduct two waves of a survey study online, survey people's daily life experience in Taiwan. The first episode is during the April 10 to April 23, 2020, and the second wave survey conducted during October 15, 2020 to December 21, 2020. We have a report in the first topic about the second episode and the third episode. Regarding the result of first wave of online survey, during April, in April 2020, we recruit 1,904 adults living in Taiwan by the Facebook advertisement. The end of this online survey was to examine what major COVID-19 information sources are available in Taiwan. Second, to examine which sources are significantly related to the self-confidence of people in coping with COVID-19. We find that people in Taiwan receive multiple sources of COVID-19 related information. The most common sources is internet media. About four-fifths of people receive information from the internet. Uh, Over half of people receive information from the traditional media. People also receive information from their family, co-worker, friends, a part of participants in this study were healthcare workers. They also receive information from the academic courses or professional training, or people may receive information from the medical staff. For healthcare worker, the use of formal lesson, for example, the government requirement asks the healthcare worker have to receive a professional training online or in the real lesson. If they use the formal lesson as the information source, there they may have a better self-confidence in coping with COVID-19. However, the significant association was found only in healthcare workers, but not in non-healthcare workers. We find that for non-healthcare workers, receive COVID-19 information from the internet uh, was negatively related to psychological well-being. If they receive COVID-19 information from the medical staff, it's positively related with psychological well-being. So the information sources uh, seems to have a very different relationship with the psychological well-being. For healthcare workers, if they receive COVID-19 information from formal lesson, they may have a better psychological well-being. We also divided the participants into four groups according to their level of risk perception of COVID-19 and the preventive behavior they use to against COVID-19. The four groups include the risk neutral. Uh, they perceive the average risk of COVID-19 with high preventive behavior, or the risk exaggerator with high preventive behavior. Uh, the third group is the risk denial with moderate preventive behavior. And the fourth group is a risk denial with low preventive behavior. We use the risk neutral as a reference and find that the risk exaggerator with high preventive behavior um, were more likely obtain information from multiple sources. Uh, Conversely, uh, the risk denial with moderate or low preventive behavior were less likely to obtain information from any sources. We also find that receiving COVID-19 related information from traditional media, internet media, and friends were associated with higher current worry, especially the information from friends. was associated with higher pest worry. Receiving information from academic courses have a lower past worry and anticipated worry. So the sources information uh, vary. The public worth was different. About the second wave, the online survey, our study question is that the people with various attitudes toward vaccination against COVID-19 have various information sources. We conduct this study between the period of October 15, 2020 to December 12, 2020. We recruit 147 adults living in Taiwan by Facebook advertisement. We find that one-fifth of the participants deny the justification for vaccination. They deny the necessity of the vaccination to against COVID-19. If the participants who were older, have a low education level, were not health worker, were in poor mental health state, especially they did not obtain information about COVID-19 vaccination from the internet, they were more likely to deny justification for vaccination. Let's come to the conclusion. People in Taiwan receive multiple sources of information on COVID-19, with the internet as the most common source. The association of information sources with self-confidence in coping with COVID-19 and psychological well-being varied between healthcare giver and non-healthcare giver. Receiving COVID-19 information from various sources was associated with various levels of COVID-19 risk and public worry. Participants who did not obtain information about COVID-19 vaccination from the internet were more likely to deny justification for vaccination. Based on the result, we suggest that medical professionals should consider subgroup of the population when they establish development the various means to deliver information on COVID-19 and the vaccine. It's my report. It's my presentation. Thank you for your attention.